Welcome to Veritas Podcast. This is our first episode. I'm Dr. Lachin Hatemi. I'm here with one and only Madison McCarthy. He's the manager of Veritas Urgent Care Group. And he's my best friend and the guy who makes things happen at Veritas. Today we're going to talk about our story, how we started, and the challenges we faced along the way, the good and the bad and the dirty. We're going to talk about it through the worst pandemic of the century. And we're going to tell you all about how Veritas started and how we are continuing our operations.
Thank you, Lachin. I appreciate you having me today. I'm really looking forward to us to diving into this topic. You know, I think it's funny because when I think about the origination story of Veritas, it's funny that although you and I are the two that kind of pioneered the whole formation of it, realistically, you already had this in your mind way before you brought me into the mix for it, and you were already scouting out locations where you thought was going to be best. You had already made your exit strategy from your current employer, and so on the back end, I'm just kind of really curious to know, 4 years in, what was going through your head? Like, how far back do you think this started when you decided, hey, I think I'm going to pull away from what I'm doing in commercial and kind of go into building my own business?
Well, starting a business is one of the biggest gambles you can take in your life. It's like rolling the dice and expect for the best outcome, which rarely happens. I knew it deep in my heart, working in urgent care prior to opening Veritas. I always wanted the urgent care. And we've met there, actually, you and me, We met there together, we worked there together. We used to go, me and Madison used to go, you and me, and we used to go take walks and talk about how we're going to open our own urgent care and dream about it.
Power walks.
And during that visit, during those conversations, we thought about the locations, and I found a building in Lexington, South Carolina, a town I have never been before. I bought the building. I took a risk. I bought the building, and I called Madison, right? I called you to start the company, and what did you say?
Yeah, I remember. It was great. When we had originally had our talks, you said, hey, if I buy a building, can we run urgent care? And I said, yeah, you buy a building and I'll build you an urgent care. This is no big deal. And then I lost track of you for a couple months because when you first left, you went and did some traveling, but you already had the real estate on the back end. And it was just after Christmas. It was like the 2nd of January. And you called me up and your words were, hey, you doing all right, bud? And I was like, yeah, I haven't talked to you in a while. And you went, you want to come look at our new building? And I said, are you serious? And you went, yeah. And so I got in the car and met you and saw where our location is now. And I was like, this is amazing. And yeah, so I think that was the start of it there. But obviously, we still had a lot of things to do. I mean, we now went into a situation where working for another person's practice, they had taken care of credentialing requirements for you. They had taken care of negotiating all the contracts. As far as setup goes, I think we circumnavigated that pretty well, like finding equipment and building contracts. But I'd love to hear you tell me a little bit more about what your thought process was going into trying to get all these insurance companies to let you have a practice.
It was difficult. I mean, we all bought the building in January, but we didn't start our operations until June. Our biggest challenge, as you know, I mean, we went through this together. It was not really opening a business or hiring people or getting the operation guidelines. The hardest part was getting contracts with insurance companies.
Yeah, super difficult.
We have obstacles after obstacles. Insurance companies were not welcoming to accept our practice into their networks for various reasons. Actually, one of the biggest private insurance companies in the state told us flat out that we will not let you open urgent care because it's against their interest for some known reasons. So it was a bad situation. It's like your biggest payer is actually your biggest competitor too. I don't want to give names here right now, but everybody can figure out who they are. So we came to this game actually way behind, and we 6 months into it, going through all the difficulties, opening and running a new clinic and hiring people and dealing with patients. We were making progress, and then something happened out of ordinary, something we never expected. It was what we call in economics a black swan event. an event that nobody predicted. It came out of nowhere, and it changed our lives, which we call the COVID pandemic.
Yeah, I don't think we weren't expecting any of that. I mean, I have some really fond memories of when we first got the clinic, when we were first getting everything going, and we're painting walls and doing things, and your mom and dad had come down to help us. And so every day it was just kind of us doing, and your mom would make us stop like at different parts throughout the day to have tea time and just relax and soak it all in, and us having conversations. You know, some of the things that we didn't really think about going into the practice was, we knew which EMR we wanted to use, so the medical record system that we used to capture patient data, and but we didn't really know how to operate the back end. So now we're faced with, how are we going to put all these codes in, and how are we going to price it out? How are we going to make it easy and functional for the staff to use? And then, you know, I remember they sent a gentleman from the EMR company down for a week for us to work with them, and even then there were just so many number of things to do on that end. Outside of that, you know, we also still had to get waste generators licenses and certifications in order to operate the laboratory, and it was kind of fun, you know, circumnavigating all those things and figuring out how we were gonna get all those things. And we, you know, and then funny enough, we built a lot of friendships in there too before we ever opened the doors, from people coming in. Almost every single person we used for ancillary services came from either a B&I group or somebody that was local in Lexington. Like Rev Local reps coming in to help us with marketing. All of our scrub tops and other mercantile equipment was from Splash Omni Media through Buzz Brands. Even the trash company came from probably some, company, yeah. You know, and so I think it was kind of fun because even before we even got open, we had already kind of made like this base connection, and then joining the chamber and doing those things. You know, I have really good memories of that. I you know, we talk about COVID, but I mean, at the time when we opened the business up, I wasn't even in the back of my head.
And then COVID came around 7 months after we opened our doors, and everything changed after that. We had a huge influx of patients. I mean, we used to see 15, 20 patients a day to about 170, 180 patients.
Yeah, I mean, we had to put limitations, and where we had, you know, built a really big priority around seeing patients very fast, which was kind of our separator from our competitors. I mean, urgent care, you're not reinventing the wheel, right? Like we're offering very similar services. It was just, could we make the services friendlier? Could we make the services faster, right? Not necessarily how much time we spend with the physician, but can intake be done quicker? Can these things, and you know, we had already kind of got built in a foundation of, these are our core values, these are the things that we want for our business to separate us. And then when COVID came, we're now struck with this dilemma that there's an influx of people coming in. We have no clue how we're even going to test them for it, because at the time everybody's got COVID, but nobody's offering a solution for send-out testing. We ended up with like 4 different companies to help us with that somewhere down the line. Yeah, even then, at some point, we had to circumnavigate to using a booking system to pre-book visits, because we just couldn't, you know, the capacity on walking in the door got pretty tough.
And we were, you know, if there's something such as being in the right place at the right time, I mean, Veritas was that. We were in the middle of the pandemic in a very central location in Lexington. And a lot of our competitors actually shut down during the first months of pandemic. They limit access to their patients. They flat out refuse to see them, or sometimes they even close down. I remember hospitals sending us their patients. I mean, we have a huge local hospital, Lexington Medical Center, were sending us patients.
Yeah, DHEC had already shut down like primary care physicians' offices because one of their employees caught COVID, and so they made them like shut down for 14 days. But like for us, the idea was that would never happen. Essential workers, you know, quote unquote, we're essential workers. So then, you know, you could shut down primary care offices, but then you're now mass flooding people to us, and then the other urgent cares also couldn't keep up. So the hospital and other places are just flooding them to us. And
wasn't it like a weird time? You know, like you cannot go to emergency room because emergency room doesn't want to see you because you are not sick enough.
Yeah, you're now
your
hurting
primary
other
care
people.
doctor won't see you, right? So you're between nowhere to go. Where do you gonna go? Emergency room is not an option. Your primary care clinic is not an option, and us, we were the only option they had. And we literally treated, tested thousands and thousands and thousands of people in Lexington.
So many problems too. Like insurances were being super vague about how we were supposed to bill individuals. And then they were paying for some stuff and not for others. Everybody wanted to get tested, but insurance was very clear. We're not going to pay for it if they don't have symptoms. Absolutely. And I think people thought we were charging really large amounts. But on the back end, when COVID first started, they didn't realize that the cost for COVID tests was so high. I mean, like, it was costing us nearly $50-some just for just for the test itself. That's not taking into consideration time spent, employment, labor, and physician services, and the cost to send those labs out somewhere. You know, people got really angry with us because it took 2 or 3 days to get your results back. But at the time, we were doing PCR testing, and those labs were so over flooded, they could only, run them, but so fast. And I mean, quite honestly, I think we got through it really well.
We did. I mean, it was weird times, right? I mean,
yeah.
When you're
unprecedented, as they say.
When I went through medical school, one of the missions of being a doctor is to treat patients, and if necessary, if we have to put our lives in danger, we have to do it. That's our obligation. That's our responsibility. But what I saw in COVID, kind of broke my heart and showed the weakness of our system. Doctor offices closed down, places that people turn to when they need help was not seeing patients, which is kind of mind-boggling. It's like your police department is shutting down in the middle of a riot, or your fire department is on a strike in the middle of a fire. The whole town is burning. Doctors were missing. I mean, they were nowhere to be found. Clinics are closed, limited appointments, and if you have symptoms, they will not see you. And so a lot of patients got desperate, and they turned to us, and we tried to help as much as possible. We never shut down our clinic. And we dealt with a lot of unknowns, unpredictable situations as we went. I mean, we will change our policies within hours. We implement the policy, and in 3 hours later, maybe it doesn't work. And let's change this, or let's use this scheduling software, or let's do this protocol, or let's just test this or test that. And in the end, we were able to treat and help a lot of people. We lost a lot of patients too. I mean, we lost a lot of dear patients to us, young and old, not just older people. Actually, we have younger patients. They lost their loved ones during the COVID pandemic. So think about the emotional toll it took on us. We are dealing with death, and we don't even have time to think about grief. Because we have under the 70 people at the door needs to be tested. They become aggressive. They become a lot of people are appreciative, but there are some people was not happy to be there and took it on us. And we were trying our best. And I'm very proud of our staff and proud of us that we went through this pandemic the way we did.
Yeah, speaking of that, let's talk about the staff portion too, because yes, patients are very anxious, but they're isolated in such scenario where, okay, I possibly came into contact with one person who has COVID. Now thinking on our end, our employment are dealing with now 80 people coming in potentially with COVID. And although the positive numbers weren't nearly as high as they were maybe a year later, do you remember we had that, the staff were so scared, we had like an impromptu staff meeting. And we did it outside because we thought that was more appropriate and kind of got everybody around in a circle.
Made a big circle, yeah.
It was really good, and we kind of told everybody, we said, we know this is a scary time. We have ascertained the equipment to keep everybody safe, the proper masks and gloves and outfits and everything. But we're very honest with them that we really had no intentions of shutting the business down or running limited hours, because we were in a scenario where we were the primary help in our area of Lexington. But we also wanted them to hear their voiced concerns as well, so we could address them, and basically gave everybody an out and said, hey, if you don't feel comfortable about this, there's not going to be any hard feelings. We just want you to kind of say it now. And surprisingly enough, although most of the employees did voice levels of concern about safety, nobody ended up leaving the business. I think we all rallied together really well and said, hey, we're here, we're going to help everybody, we're going to build business, and it really kind of built a name for Veritas, that we weren't going to be one of those people that was just going to shut down at this, at the first situation that didn't really come out that favorable. But you remember we also did outdoor clinic.
So. Oh yeah, we had a tent in the back of the clinic. We were seeing people in the tents, and the wind was blowing very heavily.
We're trying to strap everything down and
strap down the tents and try to prevent a disaster.
it was a mess.
It was a mess. It was a big mess. But
we had made like makeshift, almost looked like ER rooms. So we had like 40 square foot of tent space and had curtains to separate off all the rooms so the patients wouldn't see each other, and had one little alleyway where we were going down where you could see into each room, but they couldn't see each other, and a triage station in the front. And because everybody was scared. Nobody wanted to go inside the building. People in the front that didn't have COVID or didn't think they had COVID didn't want to mingle with people they thought had COVID. I guess I think back to notions we think of how we view leprosy, because we won't really know what leprosy is like. Leprosy hasn't been around while we've been alive, right?
Seen it, yeah.
So you see all these parodies about lepers, right? But then I think on our circumstance at Veritas, and I could probably really see how during plague moments, one faction of people were like, oh no, we're going against these people, and if you have any sign or symptom, we're going to outcast you. And we really tried not to do that. We gave everybody the same amount of dignity, whether they had COVID or didn't have COVID, and offered really reasonable treatment solutions. I'd like you to talk about the idea of when you realized that although guidelines were saying, let's don't treat with steroids, that you knew right off the bat, no, we have to treat with steroids. There's so many respiratory components here.
First of all, it was a logistical nightmare. I mean, you test people, and then in the end of the day, you put all the samples in a box, and we are driving fast to make it to the
airport. Yeah.
So
a lot of airport runs.
Yeah, FedEx can pick it up. We make it to the plane that will fly this test to the testing center. And, we tried to start treating early on. We didn't have any options. There was a lot of misinformation out there about deworming medications, and then you have the plaquenil, what else we had? Like hydroxychloroquine.
Yeah, hydroxychloroquine. Mm-hmm.
And then we have there was a lot of misinformation. And unfortunately, our politicians didn't help spreading those rumors neither. But we initially started treating with dexamethasone, which was a steroid. And that was proven 3-4 months after we started that actually works. It was the medication that helped people get out of the ventilators and ICUs in Europe. Actually, they came out of England. But there was a lot of misinformation out there, and people were buying into it. People was getting very angry. People being isolated at home. They took it on us. They blamed us for it. Most of the people were grateful, but some people actually blamed us for the pandemic, which we were trying to do our best to treat them. But we are fortunate that pandemic is behind us, hopefully, at this point. I mean, it took a huge toll on our nation.
Yeah, I mean, I don't think we'll never not see traces of COVID, just like we see the flu or anything else, but certainly we're not having the surge that we had following the original portion of it, that, the following winter got really bad. The summertime last year was... right now we're at a pretty, consistent amount of patients for summertime volumes, but last year at the same time we were almost having to put double the staff in the clinic because we had resurged back up again. But yeah, and we're not seeing nearly as many long-term or the short-term effects of it. The acute symptomology is not nearly as terrible as it had been before, but. Not to say, just like you're saying, now they're trying to stick people on Paxlovid and several other drugs that weren't out on the market at the time, because now they've done more clinical
research.
Which
I don't recommend, by the way. I'm not a big Paxlovid advocate. I don't like that medication in particular. But in a sense, we still don't know how to treat.
No,
I mean,
I don't
whatever
think so,
options we have out there is not really functional. I mean, vaccination was a big mess.
Mm-hmm.
People who doesn't like to get vaccinated, they were being forced to vaccinate also.
And the state didn't make that easy either. Everybody wanted us to give vaccines, and we did for a while. But, that was really difficult. You had like 7 different reporting agencies you had to report that to every single day. on top of reporting your just regular swabs, and there's no internal system that does that. All this is done manually. Temperature constraints on and how long you can keep the vaccine in, all the information had to be dispersed. It was a nightmare. We did that for about 4 or 5 months, and then at some point I kind of looked at and went, they can just go to the pharmacy and get it. And it, because it's nice to be able to offer that service, but in the same token, we're just not built for that kind of reporting, so to speak.
We had a high volume clinic for that. And we see like 12 hours of patients. That we see like something 80, 90 patients a day.
Yeah, and then we're still at the clinic 3 or 4 hours later doing reporting measures in the nighttime, trying, and we would take turns with the staff members as to who's doing the data entry, so other people wouldn't have to stay so late. Since then, things have gotten a little bit better. The state has done a better job of interfacing with our reporting systems, so that way it does it automatically whenever we put a result in the computer. But at the time, it didn't, and those are all difficult too. Supply chain issues. 2 months into COVID, and they almost shut down everything. Like, you couldn't get gloves, you couldn't get masks, you couldn't get, and then it was small things like, oh, you're nauseated? You couldn't even get Zofran. Like, what does that have to do? It didn't have nothing to do with it. But
we have a shortage of normal saline at some point.
We still have a shortage of normal saline. I'm literally just now, 3 years later, getting back to being able to order normal saline.
We did.
And the cost has never gone back down. They increased the cost almost 600, 700%. We were buying one box of gloves for $5. Now, after COVID, you're paying $30 for a box of gloves. Even normal saline, everything, every single item we have. It wasn't an inflation issue.
It was a price gauging issue. It's still going on, by the way. And if anybody who listens to this, we are getting price gouged on medical supplies. Gloves is one of them. Mm-hmm. Normal saline is another one. Certain medications like lidocaine.
Yeah, lidocaine.
You cannot get it. It's on the black market almost, like people charging 10 times. I don't believe these are supply chain issues. I think there are some people, unethical people, that are trying to make money off these shortages.
Yeah, I'm having to buy a lidocaine from out of Tennessee right now. Is that?
Yeah, it's a big scam. I'm sure it's not a production issue. I think it's somebody is making outrageous profits out of this. But it was interesting times. We learned a lot. We grew out of it.
Do you think we would be the people we are today if it hadn't been? Let's say the pandemic never happened. We're now sitting at a few days away from celebrating our 4-year anniversary on the 15th of June, 4 years anniversary, Veritas Health Group. And looking on it now, had we not made that push through the pandemic, do you think we would have been as successful as we are now with the community? And B, would we have been able to continue operations the way we do right now?
I'm glad we took the chances. We could shut down, and it was on the table. That option was on the table, and we refused to shut down because in our mind we were the last line of defense. If we quit, then these people have nowhere to go, and we didn't want to do that to people. It was difficult, obviously. It was difficult for the whole society, but one of the downfalls of us was we were a single provider practice. So I was the only physician, and then we were open 7 days a week. Mm-hmm. So which means I had to work 2 years with no days off. Every single day, including weekends, I had to work 12 hours. And it was difficult. We had the social isolation, because I'm a doctor, I'm dealing with COVID. None of my friends wanted to come visit me at home.
Mm-hmm. Yeah.
So I didn't see humans socially other side the clinic. I couldn't hang out with my friends because they were all scared that I would give COVID to them, so they would take it back to their families.
We were the family because we spent all our time together.
Yeah.
Nobody wanted to spend time with us.
Our families didn't want to see us, so we were actually with each other. We became family. And we became a family with a lot of Lexingtonians. People, locals here, actually embraced us because we were there. They never forget that we were there for them and in their most difficult times. So we became very strong ties to the community. We became friends with a lot of people. They recognize us. We go to local restaurants. We sit down, and everybody there knows us. We probably treated them or one of their loved ones. So that's a strong tie. So we became a part of the community. So we are not just a business coming from out of town. We are a part of the Lexington community now, and they still turn to us to receive their medical care because we are not out there to get them like the hospitals. We are there to provide the best care at a reasonable prices and at a reasonable speed and at a reasonable convenience.
Yeah, and just kind of on the ending of this, like I will say, Lexington's strong. The economy's strong. Although some businesses had to stop for a little bit, not only did we persevere through COVID, but a lot of our friends that are also independent business owners have made the push through and are prospering and doing really well. Marinona's Bakery used to be. He was able to not only turn his bar into a thriving business post-pandemic, but also expand as well. And we're seeing a lot of expansion in the area. And I think a lot of areas probably are still kind of held back from expansion. But it's nice to know that we all kind of came together. A lot of the people that own businesses also supported our business, and we do the same thing for them. Sure. And I think that's what most people need to understand. When they go into business, the aspect is everything is to focus on us, right? The focus is on your business, focus on what are you doing. But sometimes that's not always the primary focus. Sometimes the primary focus is, yes, you need to be doing right by your business, but you also got to be supporting the other businesses around you, because Absolutely. They're also going to be your largest supporters too. But anyway, that would be where I would end.
We try to use local businesses for our services as much as we can to support them. There are friends, our patients who owns those businesses that we try to support. Lexington, I would not want to be anywhere else other than Lexington, South Carolina. It's a very, very strong community. It's growing rapidly. It's expanding. It's attracting a very talented pool of young individuals, young professionals. There's a lot of immigration now to the area because of the high quality of living and good schools. So people moving here right and left from California, New York, New Jersey, and northern states. And that's a good place to have a practice, because what happens is when more people coming into your area, it increases the patient volumes because they all need doctors.
That's right.
And that proves our business. So we are continue to grow along with Lexington. When they grow, we grow. When we grow, they grow. We are going to continue to create jobs. We are continue to be people's best friends. We are continue to be there when their primary care doctor cannot fit them in the schedule or see them on a weekend, or if they're in a vacation that they cannot get in with their primary care, they can come see us, and we can provide the care same day for them for what they need.
Yeah, and cash-wise, probably even cheaper than they would get in most of it. We're probably the lowest cash cost clinic. We did our research. We kept it low. Post-pandemic, we still kept it at the same price. Other competitors have increased costs. We've kept our costs the same. So
it's a very satisfying job. It's very. You're helping people. You're dealing with people, so it never gets boring. Me and Madison never gets bored.
I'm very thankful every day for the opportunity given me for us to start Veritas Health Group. I'm 100% thankful for it, and we've gotten to impact a lot of lives and people in our local community, and you and I've got to grow. You and I today sitting at this table are not the same people we were 4 years ago.
Absolutely not. Absolutely not.
And that couldn't happen without this opportunity. So.
We learned a lot. Stormy waters make great sailors, stormy seas. So we learned a lot through the turmoil and the difficulties. COVID was a big test for us moving forward. But I think what we learned from COVID will help us expand our business and provide more medical services to the community. And our mission to make medical care is more affordable. Unfortunately, it's very expensive. And we are trying to expedite things and make it more streamlined, so you get to care as fast, as cheap as possible, and get good quality health care. I think that's essential. Nobody likes to wait in doctor's offices. I hate waiting in doctor's offices. When I go to a doctor's office for a few rare occasions, and they put me in that waiting room and a bunch of magazines for 2 hours, I would just go crazy.
Well, and I can't tell you all my secrets, but we are certainly making sure that we're keeping the same efficiencies today that we did when we first opened the business.
We are faster. You don't spend too much time in the waiting room unless we are slammed, and even then it's still faster than any of our competitors. We are fast. We are friendly. We will treat you right. We will give you more than what you expect, and we will deliver the services. And we want to build more programs to help the health of our community, to make our members, our society better, and Lexingtonians healthy, and they don't have to wait months or years to see their primary care doctor or specialists.
Well, I really appreciate you having me on today for your first podcast.
Yes.
I think this was great. I love this opportunity to do this as well, and I'm looking forward to some of the many conversations we're going to get into over the next course of however long and however many more of these we get the opportunity to make. But it won't be as rigid. There's definitely some fun in talking about how we originated and dealing with COVID, but I can't wait for us to just kind of get into some funny little topics.
Future is bright. There's so many things we can do to make healthcare better. You're a paramedic, you're a lieutenant in Florence County, you're a first responder. These are important things. I mean, healthcare is not something we can neglect. It's a human right. It's essential for our survival. And to access the proper healthcare at a proper timing, at a proper speed is important. Sometimes minutes or days count against you if you have a sickness and you need to be seen that day. And that's what we are here for, to catch diseases early, treat them, and intervene in the treatment of the care before other doctors can come on board. So urgent care is actually essential for our society and the health of our community. Without us, they will suffer quite a bit, and we don't want that to happen.
Well, that's okay. It's just in time. Summertime mishap, come see Veritas Health Group. That's what I'd say. No matter what kind of mishap, just come and see us.
Yes, I hope
we got you covered.
As I said to all my patients, I hope you never need my services, but if you need it, you know where to find me.
Right here.
Right in the same spot. And me and Madison, we're going to help you.
Yeah, you're going to see our faces almost every day. Whether you're in our Lexington or Columbia clinic, you're going to find one of the two of us.
So we are on our job, and we are here to help. And we are on the ground. We have grounds on the boot, and we will be taking care of you and your loved ones, so you never feel like you have been neglected or you don't get the proper care. We will ensure that you're being seen and heard and treated properly, so you can continue your beautiful lives.
Mm-hmm. Thank you, boss.
Thank you.
I appreciate it.
Thanks for coming.
Yeah, looking forward to it. Hey, so we're so glad you were here with us today. But for more information, you've got to check us out on Facebook. We also want you to check this podcast out on iTunes, on Spotify, on Facebook, and YouTube. Also, to remember, you can always find us going to www.veritasurgentcare.com. You can conveniently book your appointment down at our Columbia clinic right now online. You don't have to. You can walk into either one of our clinics, but phone numbers are there. Important information about the doc and I and several other staff members on there as well. So we hope to see you soon.